Okay, so, you're petting your dog or your cat, just a normal day, and then you feel something, a weird lump. Maybe a leg looks puffy,
Mhm.
or their chest or belly seems, I don't know, kind of swollen. It just pops up, feels unexpected, maybe even a bit alarming.
Right. And you might just think, oh, it's just some simple swelling.
Exactly.
But you're absolutely right to pay attention because that puffiness, well, like a lot of things in vet, it can be the tip of the iceberg, a sign of much more happening underneath.
Yeah, it's like one symptom can point in so many different directions.
Definitely. A classic signal flag.
So that's our mission for this deep dive. We're going to get into some really good source material excerpts from a veterinary text on canine and feline peripheral edema.
Okay.
Peripheral edema, basically swelling you can see or feel, often in the limbs, maybe the body wall, the head. We want to unpack what causes it, what signs to look for, and importantly, how vets actually figure out the why and then what they do about it.
Sounds good. A shortcut through the complexities.
Exactly. So let's start right at the beginning. What is peripheral edema, technically speaking?
Okay, so the source defines it pretty clearly. It's an excessive buildup and accumulation of tissue fluid.
Tissue fluid.
Yeah, the fluid that's normally in the interstitium is basically the space between the body cells and the blood vessels. Too much fluid gets trapped there.
Okay, so fluid overload in the wrong spot. And the source mentions it often appears in dependent areas. What does that mean?
Right, dependent just means the lower parts, where gravity tends to pull fluid. So think the lower chest, the belly, or down in the paws and legs.
Makes sense. And it can be just one spot
Right.
or...
Or more widespread, yeah. The source says it can be localized, like just one limb, or it can be generalized, affecting larger areas, or even the whole body.
Got it. Now, the really crucial part seems to be why this fluid builds up. The source mentions 4 core reasons.
Yes, the pathophysiology. It boils down to how fluid moves between tiny blood vessels, the capillaries, and the surrounding tissue, and how it gets drained away by the lymphatic system. So the 4 big mechanisms are: 1, the pressure inside those capillaries is too high, pushing too much fluid out.
Okay, high pressure out.
2, the capillary walls themselves become too leaky, increase permeability, letting fluid escape when it shouldn't.
Leaky pipes. Got it.
3, there's a problem with the lymphatic system, the drainage network. It's not clearing that excess fluid away effectively.
Yeah, blocked drain.
Exactly. And 4, this one's interesting, there's low plasma colloid osmotic pressure. Basically not enough protein, especially albumin, in the blood.
Protein. How does that affect fluid?
Well, protein in the blood acts like a sponge, helping to pull fluid back into the capillaries. If protein levels are too low, that pull weakens and fluid stays out in the tissues.
Okay. So high pressure out, leaky pipes, blocked drains, or a weak sponge effect. That covers the main ways it happens.
Precisely. The source notes the body systems most obviously affected are usually the musculoskeletal system, the limbs and the skin.
Right, where you actually see and feel the swelling.
Yeah.
So let's talk signs. What might someone notice, or what would a vet be asking about?
Well, beyond just seeing or feeling the swelling, the vet's going to dig into the history. Have there been any allergies, immune issues, any known heart, liver, or kidney problems, any recent trauma, exposure to anything nasty like snake venom, bee stings, even ticks or other creepy crawlies?
Trying to find that trigger, that potential connection. And what about during the actual physical exam?
Obviously, the swelling itself is the main event, but how it presents gives clues. The source mentions that non-inflammatory edema, so swelling that isn't red, hot, or painful, often shows up first in those dependent areas we talked about.
Okay, the lower spots.
But if it is inflammatory, maybe from a bite or an infection, it could be anywhere, really, not necessarily following gravity.
Can you tell anything just by, pressing on it?
You can, yeah. The classic sign is pitting edema. That's where you press a finger into the swollen area and it leaves a little indent, a pit, that slowly fills back in. That pitting strongly suggests it's due to that excess fluid we talked about, the pressure or protein issues. But sometimes, the source notes, you might get non-pitting edema.
And what does that suggest?
That might point more towards inflammation, making the tissue itself feel firm, or even something like mixed edema, which is related to severe hypothyroidism, where the tissue consistency changes.
Wow, okay. So just how it feels provides important clues right away. Now let's dive into the really big list of the causes. The source seems to stress that finding the cause is absolutely critical.
It is, because the diagnosis, the treatment, the prognosis, it all hinges on knowing why the edema is happening. And yet it's quite a list.
How does the source break it down?
It helpfully splits it into localized causes
Hmm.
affecting just one spot or a limb, and then regional or generalized causes, which are more widespread.
Okay, let's start local. What could cause swelling in just one leg, for example? High pressure.
For localized high pressure, think blockages, blood clot in a vein, maybe an artery thrombosis, or something called an arteriovenous fistula, which is an abnormal connection between an artery and a vein right there.
So, like a plumbing problem in that specific limb, backing things up. What about leaky vessels in one spot?
That's often a direct insult right there.
Yeah.
Could be an immune reaction happening locally, maybe an infection setting up shop, or a toxin. The classic examples the source gives are things like a snake bite or a bee sting.
Right, causing intense local reaction.
Exactly. Burns or physical trauma to that area can also make local capillaries leaky.
And the blocked lymphatic drain locally?
That points to something obstructing the lymphatic vessels in that limb. Could be inflammation of those vessels, lymphangitis, which might be infectious or sterile. It could also be cancer cells spreading and blocking the lymphatics.
Cancer. Wow.
Yeah, primary or metastatic. Or sometimes it's congenital. The animal was just born with poorly developed lymphatics in that specific limb or area.
Goodness. So one swollen leg could be anything from a bee sting to a blood clot to cancer to a birth defect. That's a lot.
It really highlights the diagnostic challenge.
Okay, now let's broaden out. Regional or generalized edema affecting bigger areas or multiple limbs, high capillary pressure again.
Here we're usually looking at bigger systemic problems. Congestive heart failure, or CHF, is a really common one. The heart isn't pumping efficiently, so fluid backs up systemically.
Makes sense.
Also, cardiac tamponade fluid building up around the heart and squeezing it. Big blood clots in the major veins, the vena cavae, can cause widespread backup too.
What else?
Kidney failure can cause the body to retain too much salt and water,
Right.
increasing pressure. And even just being down for a long time, prolonged recumbency, can interfere with normal blood return, leading to dependent edema. Oh, and sometimes even a bandage wrapped too tight can act like a tourniquet.
Wow, okay, so heart, major vessels, kidneys, even just immobility or a bandage. What about widespread leaky vessels?
That suggests something affecting the whole system. Severe, widespread infection, sepsis is a big one, or conditions like vasculitis, where blood vessels all over the body become inflamed and leaky.
Systemic inflammation hitting the vessels, and generalized lymphatic issues.
Similar idea to the local causes, but on a larger scale. Maybe widespread inflammation, infection, or cancer affecting lymphatics broadly. Or, again, a congenital issue where the lymphatic system didn't develop properly overall.
Right. And then the last big category, low protein in the blood, that weak sponge effect. This sounds like a major cause of generalized swelling.
It definitely is. The source really emphasizes this. It often comes down to either losing protein somewhere or not making enough.
Losing it how?
Through protein-losing diseases. Certain kidney diseases, like nephrotic syndrome, cause protein to leak out into the urine. Or specific gut problems, like intestinal lymphangiectasia, cause protein loss into the intestines.
And not making enough.
That usually points to the liver. Severe liver disease, like cirrhosis, means the liver can't produce enough albumin and other proteins. Also, really severe burns can cause massive protein loss through the damaged skin.
It's just fascinating and a bit overwhelming how many different disease pathways can lead to that same outward sign of swelling.
Absolutely. And the source also throws in a genetic component for some types, especially lymphatic issues.
Oh, right, you mentioned breeds.
Yeah, it lists breeds like bulldogs, poodles, Old English sheepdogs, labs, and some cats as being more prone to primary lymphedema. I mean, they're born with it. There's even a documented lethal form in bulldogs.
Okay, so faced with this enormous list of possibilities, how does a vet actually zero in on the cause for a specific patient? It feels like detective work.
It absolutely is. And like any good detective, you start with the clues, the physical exam, the history, and especially the pattern of the swelling.
How does the pattern help narrow it down? The source gives examples, right?
Yes, some really helpful ones. For instance, if you see swelling in both front legs and the jugular veins in the neck look distended or full,
Okay.
that strongly suggests something is blocking the big vein, draining the front half of the body, cranial vena cava syndrome.
Got it. What about the back legs?
Bilateral rear limb edema, especially if there's also fluid in the abdomen, called ascites, that points towards either that low protein problem we discussed or a blockage in the main vein draining the back half, the caudal vena cava.
And if multiple limbs are swollen plus other signs.
Right, if you see limb edema, maybe fluid in the chest or abdomen, and those distended jugulars, that combination really points towards heart disease causing backup everywhere.
So the distribution is a huge clue. What about other specific findings?
Yeah, the source mentions a few others, like if there's focal edema and the vet can feel a vibration or hear a specific noise, a bruit or fremitus over it, that could indicate one of those arteriovenous fistulas.
Ah, the abnormal vessel connection.
Exactly. If the swelling is focal and red, maybe an insect bite. If there's widespread edema, along with little pinpoint bruises or larger bruises, petechiae or ecchymosis, that could signal a bleeding disorder or that vasculitis, the leaky vessel inflammation.
Okay, so the exam gives strong directional clues. Then come the test, I assume.
Definitely. Baseline lab work is usually the next step. A CBC complete blood count biochemistry panel and urinalysis.
What are you looking for there?
Lots of things. Signs of infection or inflammation in the white blood cells. Low platelets, which could tie into vasculitis or clotting problems. And crucially, protein levels, especially albumin. Is it low? Is there a protein showing up in the urine analysis?
So screening for infection, inflammation, bleeding issues, and those big protein problems, what if those initial tests point towards something specific?
Then you dig deeper with more targeted tests.
Okay.
If kidney protein loss is suspected, you quantify it with a urine protein.creatinine ratio. Maybe test for antithrombin loss. If the gut is suspected, maybe an intestinal biopsy. If the liver function tests or a biopsy. If platelets are low, you might need tests for tick-borne diseases like Ehrlichia or Rocky Mountain spotted fever, maybe an ANA test for immune disease, or even a bone marrow biopsy.
Wow.
Yeah, and if infection seems likely, cultures are key. If fluid has built up in the chest or abdomen, analyzing a sample of that fluid gives vital information. And if myxedema is suspected from low thyroid, specific thyroid tests are needed.
It's a serious investigation. What about pictures, imaging?
Imaging is critical, especially if you suspect heart disease or a blockage. Chest x-rays and an echocardiogram and ultrasound of the heart are standard workups for the heart.
Right.
Ultrasound is also great for looking for clots in blood vessels or checking abdominal organs. Sometimes more specialized things like angiography or perfusion scans are needed for tricky vascular issues.
And actually sampling the swollen tissue itself?
Yeah, sometimes a fine needle aspirate is done. You stick a small needle in, get some cells or fluid, and look at it under the microscope or send it for culture. Or a full biopsy might be needed, taking a small piece of tissue for detailed microscopic examination, which can be really definitive for things like inflammation, cancer, or lymphatic problems.
So all this testing, it's all driving towards that one goal, identifying the specific underlying cause.
Exactly. Because, as the source keeps saying, the treatment has to match the cause. You can't just treat swelling.
Right. Which brings us to treatment. It's not just about diuretics, is it?
Definitely not. In fact, diuretics can be harmful if the edema isn't cardiogenic, isn't from the heart.
Okay, so what are the approaches? General care first?
Yeah, basic supportive care is important. Good nursing care, especially for animals that are down, to prevent bed sores or decubital ulcers. Sometimes warm compresses can help if there's localized infection.
Activity changes. Diet.
Activity might need restriction, especially with heart failure. And yes, diet changes can be crucial, like special low-protein diets for certain kidney diseases, or maybe low-fat diets for intestinal lymphangiectasia.
What about surgical options?
Surgery comes into play for specific problems. Trying to remove a blood clot, surgically fixing an AV fistula. Sometimes, unfortunately, if a limb has severe, untreatable localized edema, amputation might be considered. There are also some specialized, often palliative surgeries for chronic lymphatic issues, but they're complex.
Okay, now the medications, the source lists quite a few. It seems tailored to the cause.
Absolutely. It's all about targeting that underlying mechanism we diagnosed.
So, like, if it's a severe allergic reaction, anaphylaxis.
Emergency drugs, epinephrine, injectable steroids like prednisone sodium succinate. Maybe antihistamines, though their benefit once anaphylaxis is rolling, is debatable according to the source.
Okay. What if it's heart failure causing the edema?
Then you're using a combination of drugs, usually. Things to help the heart pump better, drugs to relax blood vessels, and diuretics like furosemide to help get rid of the excess fluid.
And if it's immune-mediated, like vasculitis?
Immunosuppressive therapy is key. Prednisone is common, maybe stronger drugs if needed.
Infection.
Appropriate antimicrobials. Antibiotics for bacteria, antifungals for fungi. Ideally, based on culture and sensitivity testing. For specific things like tick-borne vasculitis, tetracycline or doxycycline is mentioned.
What about toxins, like that snake bite example?
Antidotes if they exist. So antivenom for snake bites.
And the myxedema from low thyroid.
That's treated with thyroid hormone supplementation, T4.
What about those tricky situations, the low protein or clotting problems?
For low protein causing poor oncotic pressure, you might need intravenous fluids that help hold volume in the vessels, like hetastarch or even plasma transfusions. Sometimes, very carefully, a continuous low dose of furosemide might be used alongside these volume expanders.
Interesting. And for clotting issues like DIC or antithrombin loss?
Anticoagulant therapy, heparin, maybe warfarin, clopidogrel drugs to prevent further clots, but they need super careful monitoring.
It really drives home that there's no single edema drug. It's targeted therapy.
Precisely.
And the source makes a big point about things not to do, right?
Hmm.
Contraindications and precautions.
Extremely important. We already mentioned not using diuretics unless it's heart failure. Also, avoiding steroids if there's an active infection you haven't got under control.
Right.
Epinephrine is generally only for anaphylactic shock, not other types. Certain beta blockers like propranolol should be avoided in pets prone to asthma-like symptoms.
And things to watch out for while treating.
Lots of monitoring.
Mhm.
Avoid intramuscular injections if platelets are low. Taper steroids slowly after long-term use. Be cautious with epinephrine if there's a risk of certain heart rhythm problems. ACE inhibitors used for heart or kidney issues need care if kidney function is already poor. Long-term antibiotics risk secondary fungal or resistant bacterial infections. And anticoagulants carry a real risk of serious bleeding if not monitored perfectly.
These details really show the careful balancing act involved. Okay, so treatment is started. What about follow-up? How do you track progress?
Again, it's tailored. You might need to repeat blood counts, check kidney values, remeasure protein in blood or urine. For pets on anticoagulants like warfarin, weekly clotting time tests are mentioned.
Sure.
Sometimes follow-up biopsies, like of the kidney, might be needed for prognosis. Repeat cultures or antibody titers for infections. And for pets on thyroid meds, checking hormone levels periodically after dosing is needed to ensure the dose is right.
And prevention. Can we prevent edema?
Only by preventing the underlying cause, as the source says. So, good preventative health care, managing chronic conditions like heart or kidney disease effectively, avoiding toxins, that's the best approach.
Makes sense. The source also lists potential complications from edema itself or the underlying issues. Some sound quite serious.
They can be, yeah. Chronic swelling can lead to skin breaking down, those decubital ulcers. Depending on the cause and treatment, fatal bleeding or fatal clotting events are possible complications. Organ failure, heart, liver, kidney, gut can become refractory, meaning it doesn't respond to treatment anymore. Malnutrition can develop, even brain swelling in severe cases. And resistant infections or sepsis are always a risk with complex medical conditions.
It really underscores that seemingly simple swelling can be linked to life-threatening problems in the outlook, the prognosis.
You guessed, it entirely depends on the underlying cause. Edema from a bee sting. Usually excellent prognosis. Edema from widespread metastatic cancer or end-stage heart failure. Obviously much more guarded.
Well, this deep dive really took us from noticing that initial, maybe simple-looking swelling all the way through this incredibly complex web of potential causes.
Yeah, involving fluid pressures, vessel leakiness, lymphatic drainage, protein levels.
Triggered by everything from allergies and injuries to major diseases like heart failure, kidney failure, immune disorders, infections, even cancer.
And it shows how vets have to use this systematic approach, the clues from the exam, layering on the diagnostics to unravel that web and find the specific cause.
It's just amazing veterinary detective work, which leaves me with a final thought, really. Given that huge list of possibilities, all the tests, the treatment nuances, how do veterinarians manage to sift through it all efficiently, especially when a pet might be critically ill? Finding that right answer, the best path under pressure, that seems like the real art and science here.
It truly is. Experience, pattern recognition, systematic approach. It all comes together.